we are making two significant changes that will help get those under 18 back into childcare or the classroom as quickly and safely as possible while minimizing the risk of COVID-19. The first change is that we are removing runny nose and sore throat from the list of symptoms that require mandatory isolation for children. In the last week alone, more than 3,400 children and youth were tested for COVID and reported having a sore throat. Of those, just a little over 700 had a sore throat as their only symptom. Less than 1% of those tests were positive. Similarly, more than 3,300 children were tested with a runny nose, with only 601 of whom having a runny nose and nothing else. Less than 0.5% of those tested positive for COVID-19. This shows us that these symptoms by themselves are very poor indicators of whether a child has the virus. Based on our data so far, the risk that a child with just one of these symptoms has COVID is even lower if that child is not known to be a close contact of someone with COVID-19. I want to be clear that this change is only for those who have not had a known exposure. If a child has had close contact with a COVID case in the last 14 days, then a runny nose or sore throat is still enough to recommend testing, and they would still need to continue to stay at home in self-isolation. The second change that we are making is to shift towards a more targeted checklist, one that takes into account the total number of symptoms that a child may have. Any child who has even one of the core isolation symptoms, which are cough, fever, shortness of breath, and a new core isolation symptom of loss of taste or smell, must still isolate for 10 days or have a negative test result and resolved symptoms before resuming activities. That is not changing. However, for all other COVID-19 symptoms, we are shifting to a more strategic approach. Starting on Monday, if a child has only one of any of the other symptoms on the list, they should stay home and monitor for 24 hours. If their symptom is improving after 24 hours, testing is not necessary, and they can return to normal activities when they feel well enough. However, if the child has 2 or more symptoms on the list, then testing is recommended, and they should stay home until the symptoms go away or they test negative for COVID-19. To use a practical example, if a child has just a headache, they should stay home for the day, and if things improve, they can return to school as soon as they're feeling able to do so. But if they have a headache and a runny nose, then they should stay home and either get tested or stay home until the symptoms go away completely. Once again, we are acting on the evidence, which shows that any one of these symptoms individually is a poor indicator that a child has COVID-19. However, 2 or more symptoms increases the risk, and so changes the approach that we need to take. Today's changes align with similar ones made in BC, Ontario, and Quebec.